Hello, I'm Dr. Sharmila Patil. I'm working as a Developmental and Behavioral Consultant at KEM Hospital, Pune. I work at TDH unit. It's a Child Development Center. Here at TDH, I work as a consultant as a Developmental and Behavior Pediatrician. So what is Developmental and Behavior Pediatrics? It is a branch of pediatrics which deals with the special children and their emotional, social, learning and also educational needs with their physical disabilities or disorders. There are wide range and varieties of child developmental disorders ranging from the emotional, social, cultural, educational. So at every step since the birth till 18 years of life, whatever they face, the behavioral, emotional problems, we tackle it at every age group. So all age groups has a different emotional, educational and behavioral pattern. So what we do as a developmental pediatricians, when the child comes to us, when there is no growth or no developmental or there are some developmental issues like delayed development, global developmental delay or particularly developmental delay in any one domain like cognitive domain, social domain, gross motor and fine motor. So we analyze this, we first clinically take the history, analyze the clinical problems, do the basic investigations, find out what are the different age appropriate milestones which the child has achieved or not achieved, and accordingly do the few assessments or investigations and then carry out the diagnosis, and most important part is the early intervention. So as a developmental pediatrician, we emphasize more on early intervention because it is said that till 5 years child's brain is developing and there are lot of stimulations and pathways which are building up, which helps if we start the early intervention as early as possible. So developmental and behavior pediatrics covers even the neonatal care, high risk babies, whatever the developmental delays we pick up like cerebral palsy. So if you start the early interventions, the outcomes are good. And now very common and very commonly seen is the autism spectrum disorder or ADHD, oppositional disorders, conduct disorders, behavior disorders, disorders due to the small families or environmental disorders. So all these are catered here. At TDH, we have an entire team which includes the psychologists, occupational therapists, speech therapists, as well as the behavioral therapist, social worker. So we work in a team. It is not one-man show. It is the entire team which we evaluate the child at the different developmental phases and help them accordingly. Thank you.